Imagine stepping into a hospital as a nursing student or a new nurse. The bustling corridors, the myriad of medical terms, and the diverse range of patient needs. It can all seem overwhelming. Now, what if there was a theory that not only guided your practice, but also transformed the way you connect with your patients? This is where Hildegard Peplau's theory of interpersonal relationships comes into play, a cornerstone in nursing education and practice. Hildegard Peplau, a towering figure in nursing, introduced a revolutionary idea in the mid-20th century: the focus on the nurse-client relationship as the foundation of nursing practice. But what makes this theory so pivotal? How does it shape the way nurses interact with their patients today? And why is this still relevant for nursing students and practicing nurses alike? In this video, we'll delve into the essence of Peplau's theory, exploring its key concepts and lasting impact on nursing. From the dynamics of a nurse-patient interaction to the implication in modern healthcare settings, we'll uncover how Peplau's insight revolutionized nursing. So stay tuned as we unravel the story of Hildegard Peplau and her enduring legacy in the world of nursing, providing a guiding light for generations of healthcare professionals. But first I want to say hello to my fellow healthcare warriors out there. I'm Martin, your Danish male nurse, here to help you deliver better care for all types of patients. Building on the intrigue surrounding Hildegard Peplau, let's turn back the page to the early years, which sets the stage for her groundbreaking work. Born in 1909, Peplau witnessed the devastating impact of the influenza pandemic of 1918, a pivotal experience that ignited her interest in nursing. Her journey in nursing began in the 1930s. A time where the field was heavily dominated by medical practice, with little emphasis on the psychological and interpersonal aspects of patient care. Peplau's education and experiences, especially during World War II, where she served as a nurse in the Army Corps, profoundly shaped her perspective. It was during these formative years that she began to see the immense potential of nurse-client relationship. She realized that nursing was not just about medical care. It was about understanding, connecting with the patient on a deeper level. This realization led to the birth of her theory about interpersonal relationships. In the late 1940s, Peplau's theory was revolutionary, not only because it challenged the existing medical-centric view of nursing, but also because it provided a structured framework for understanding the dynamics of nurse-patient relationships. It emphasizes the role of the nurse as an educator, counselor, and advocate, transforming the way nurses approach patient care. As we delve deeper into the theory in the following section, we will see how Peplau's early experiences and insight laid the foundation for a theory that would forever change the landscape of nursing. Continuing our journey through Hildegard Peplau's influential work, we now delve into the corner concept of her theory of interpersonal relationships. This theory is more than just a set of ideas. It is a roadmap for nurses to build meaningful relationships with their patient, relationship that goes beyond routine medical interactions. At the heart of Peplau's theory lies the nurse-patient relationship, which she categorizes into 4 sequential phases: orientation, identification, exploration, and resolution. In the orientation phase, the nurse and the patient meet and begin to understand one another. It's about laying the groundwork for trust. The identification phase sees the patient beginning to respond to the nurse and start participating in the treatment process. In the exploration phase, the patient makes full use of the services offered, leveraging the nurse's expertise and guidance. And finally, in the resolution phase, the patient's needs are resolved and the relationship ends. marking a successful nurse-patient journey. Each of these phases plays a crucial role in the therapeutic process, helping patients navigate their healthcare journey with a trusted ally by their side. And if you have any great stories you want to share, then share them down in the comments. And just remember one thing, don't disclose which patient it is. But let's return to Peplau's theory, because it goes beyond these phases. It emphasizes the importance of communication, empathy, and mutual respect in nursing. And this is where the theory truly shines. By understanding these concepts, nurses can transform their practice, making each patient interaction more than just a task, but a step towards a holistic healing and care. And as we reflect on these principles, we can see how they apply not only in traditional nursing settings, but also in a broader context of healthcare. Building upon the foundational concept of Hildegard Peplau's theory of interpersonal relationships, let's explore its profound impact on nursing practices. Peplau's vision has not only shaped nursing education, but it has also transformed how nurses interact with their patient in clinical settings. The theory's emphasis on the phases of this nurse-patient relationship has revolutionized nursing care. Nurses now approach patient care not just as a series of medical tasks, but as an opportunity to engage with the patient, understand their emotional, psychological, and social needs. This holistic approach has improved patient outcomes, as nurses are better equipped to tailor their care to each patient's unique situation. Moreover, Peplau's focus on communication skills and empathy has led to a more effective patient education and counseling. Nurses today are seen not only as caregivers, but also as educators and advocates for their patients, a role that Peplau championed, and this shift has fostered a more collaborative environment in healthcare, where patients feel more empowered and involved in their own care. Case studies and real-world examples abound where Peplau's theory has been applied successfully, from mental health nursing to acute care settings. Her principles have guided nurses in building stronger therapeutic relationships with their patients, leading to a more effective care and improved patient satisfaction. So, all you hospital managers out there, Peplau's theory, make sure your nurses knows about it. But as we draw nearer to the conclusion of this video, it is clear that the legacy of Hildegard Peplau and her theory continues to resonate in the nursing profession. Her insights into the nurse-client relationship have not only stood the test of time, but have also become an integral way that nurses interact with patients and how they are taught today to interact with patients. And if you want to be better at giving holistic care, then check out my playlist right over here on Kari Martinson's theory. Yeah, I urge you to click it because it is a great way to learn holistic care.